Hey, good morning, ladies and gentlemen, council. I'm going to call this meeting to order. We have an agenda before us, and I'm just wondering if there's any additions to the agenda.
Administration like to request the following under 9, new business. 942, policy number C-2B-033, disposal of asset policy amendment.
Okay, thank you. Any other additions? Kevin? No? Okay, I'm looking for a motion. All right. Thank you, Councillor Kraviak, for adopting the agenda, amended agenda. Any discussion on this, gentlemen? I'm seeing none. I'll call for the vote. That's carried. Thank you. I have the adoption of the minutes before us, the regular meeting of council, May 27, 2025. Looking for a motion, gentlemen. Thank you, Councillor Crick. Thank you, Councillor Crick, for making this motion. The council approves adoption of the minutes of May 27, 2025 regular meeting of council as presented. Any discussion, gentlemen? I'm seeing none. I'll call for the vote. That's carried. Thank you. I think we have the delegation from the city of Cold Lake here, so I think we're going to just ask them to come right on up. Good morning, gentlemen.
Good morning, kids. How's everybody doing? Good. So Mayor Craig Copeland, City of Cold Lake. I'm joined by, that's going to do most of the talking, is a good mayor, always hands over to the CEO, so I don't get in trouble. But Kevin Nagoya, we got a pretty beefy presentation, but we'll try to do our best to fit it in 15 minutes. What we're trying to do here is just awareness for your council. We've been on a journey, as many of you know, in regards to doctors in our community, in our area, to service everybody. There's going to be some interesting facts in there. Always remember when you're looking at the presentations based on City of Cold Lake, but I think a lot of the information can dovetail to the MD of Bonnyville residents. I think there's a lot of data in there that'll be very similar to your residents for sure. We started this, Kevin will have it in the presentation, but there really isn't an ask of your council. It's more of an awareness. If you want to be part of the funding, by all means, we won't turn anything down, but we're really here for awareness, answer any questions. Did we want to be in this game? No, but we decided to. After many years, to get involved. We were there as a lobbying, hoping doctors would do the initiative themselves, or AHS would. But in the end, you'll see in Kevin's presentation, council decided to get into the business of owning a medical clinic. So I'll turn it over to Kevin. If you have any questions, just fire away. I'm sure during Kevin's presentation, he'll answer everything.
Thank you. Just a picture that we like to always include, something about City of Cold Lake, Lakeshore Drive. I'm sure you've seen what's going on down there. Lots of infrastructure going in to make a linear parkway. Nothing to do with the subject, but like to do nice little pictures on there. Am I pressing the right button to go slide? Well, there we go. There we go. A little bit of background, of course, long time, as his worship said, there's a lot of history with regard to the file. MD of Bonnyville has also been involved in this from Hearts for Healthcare, the original CLR3, providing funding from a kind of that community group perspective. The kind of that last paragraph or that last bullet is always important in this. You know, there's been financial consideration, supports, government priorities. There seems to be issues always hindering on how many doctors are the attraction of doctors to a community. It's not always just financial considerations. There's personalities that involve. Sometimes there's thresholds in terms of, because the doctor's practice is also to some degree a private practice, so we want to make sure there's, that balance of equity, of making sure that there's revenue in terms of those businesses as well. So there's a lot of different influences in regards to the system. Trying to go ahead, sorry, this thing transitions a little slow, my programming. Little bit of history. Back in you can see that 2005, 2006, the CLR3 formed. When the city of Cold Lake kind of grew to that 13.9, kind of CLR3 shifted to that Hearts for Healthcare that you see today. And that is actually, the MD of Bonnyville is that organization that the annual gala and stuff like that you see. And then, of course, up until 16,000 here, you can see that we did a kind of a census through the election process, last municipal election process, and you can see how many individuals within the community don't have physicians. And those numbers that are on the bottom right-hand corner is kind of the crux of the problem that we're experiencing within the city. I would say, as his worship said, that this would kind of amplify and go consistently to the MD of Bonnyville, within at least the kind of that Cold Lake region on that east side of the MD of Bonnyville, that these numbers would be consistent in that regard. You guys can print this. The MD does have this presentation. That last paragraph is what's important here, is in order to establish a foothold, the MD of Bonnyville, or the city of Cold Lake, decided to look at how do we enter into a business to provide medical services for the community. And that was key, because we went through lots of funding, lots of money being spent on an annual basis, but the outcomes seems to be is that you have the same amount of doctors in, same amount of doctors out. It's just kind of that revolving door aspect, and how do we interrupt that? How do we get to be on the inside to understand what the issues are and being able to help with regard to resolving some of those issues? Summary of the events. In 2022, Glacier Medical Clinic, some of the physicians were unhappy with AHS at that time, so they were looking to exit the community. So this was the opportunity that stood up at that time for the city of Cold Lake to understand how primary care medical clinics are operating in terms of the business envelope, and what regulatory approvals are going to be necessary, because there's no other MCC that existed out within the province that delivered primary care medical services, so that owns the systems itself. And so therefore, it took a little bit of a while to have discussions with Alberta Health, because we do have to be registered and certified by Alberta Health. And then there's the Alberta Health Services component. And yes, there are two different organizations. And then the College of Physicians, to have there is a registration number that we have to maintain with them for billing purposes for the doctors themselves. Ongoing negotiations occurred between August and October of 2023, and essentially this just kind of plays through the round. What was really interesting is that fourth bullet there. Council held a statutory public hearing. What was really of interest of the statutory public hearing, no City of Cold Lake residents attended. The room was filled with MD of Bonnyville residents for the city of Cold Lake, in terms of trying to understand what this is going to be and how this will impact the community and the region. That was of interest. That was fascinating. And I learned something from that meeting. Largely they were from a place called Rat Lake, and I thought it was derogatory. It's actually a place. I did not know that. And then council gave the authorization to proceed with the MCC thereafter, after the statutory public hearing, and commenced operations on March 1st, 2023. So we've been operations now for a couple of years. The board of directors you can see that is Paul McWilliams there. He used to be with the Lakeland Credit Union. He is now an employee of the city, so he's been removed from the board of directors. They are looking for another person to sit as the board of directors that are on there, and their inaugural meeting was in May 2023. Now, what's neat here is that the original doctors that were in the clinic was Joe Lindy Van Ziel and Dr. Zed. He was a newer individual during our transition time. And then I'll go to the later is how many doctors that we see today. So this is the location of the clinic and the hospital, the smaller circle being the clinic, and it's within kind of that block radius so that the doctors can walk back and forth to see patients and whatnot from the hospital. It's good. It's a good location. But it just does need renovations and an expansion, and we figured that an investment is going to be necessary. In order to get involved into the medical clinic, the City of Cold Lake invested approximately $1.85 million in building, land, and equipment. This is a slide that is a little bit closer of the area. The building footprint is pretty small. This is the existing clinic floor plans. I just kind of cropped it out just for the purpose of this. You can see that there's approximately 1, 2, 3, 4, 5, 6, 7, 8 real in terms of patient, where patients can be seen. There's a couple of other procedural rooms that are there. Basically, it was 2 clinics in one, and you can see that there's a common reception area. So right now, as it functions right now, there's 2 separate. If you're going to see a doctor, you have to be on the other side. You have to go back outside of the clinic to go in through the other doors, which is a real challenge because it was designed to be one. It was a kind of we'll call it primary care medical clinic initially, and then a kind of a, we'll call it mental health drug addictions clinic on the other side. So they're keeping the whole process separately with the previous doctors. So now we have to look at how do we renovate the space and how do we change this in order to more function as one medical clinic. And then the MCC also leases that bottom left-hand corner that you see there as a pharmacy. And that really helps because we do charge them at full market value. So it does provide some revenue for the space in terms of the financial investment that is involved to help balance the budgets that are there. Upon taking over, Glacier Gate Medical Clinic was converted to CL Medical Clinic. That is the new branding that you see that is outside the building. So that is being integrated into the operations. And for some reason I must be going somewhere on my mouse, sorry. This is of interest. This is the new doctors that are all within the clinic now. This is a great news story for the MCC. It is fully loaded at this point. We are busting at the seams right now. We do have one more doctor that would potentially be coming this summer. It is the spouse of one of the doctors that are listed on this list and would like to be working out of the clinic as well. But we're basically right at capacity. You can see how small the clinic is, and those numbers that you see there makes it difficult. Even though that they do take a lot of rotations in the emergency room and kind of the surgical assists and whatnot, there are times where you have 3, 4, you could have 5 doctors that are in there, which makes it really challenging for space. And that's where we have kind of launched to, is the reason why we're here today, of just providing a project update in regards to where we are today. The services that are provided by the MCC to the doctors, this is a list of everything that is done by the MCC itself for the physicians. Organizational structure, we don't have to spend too much time on any of this. Some of the strategic planning that has been looked towards is more clinic hours, patient availability, what we're looking at is trying to integrate more full-time doctors for dedicated medical time, so clinicians. It's great to have a bunch of doctors that are doing hospital rotations, but it's also good to have doctor dedicated, so that way they can cover each other off for patients and whatnot for customer service in there. So we do have one doctor, Dr. Tian Van Ziel, that is a dedicated clinician right now. It'd be nice to have another one yet, but we're not there yet. We can't push too hard because we just don't have the space right now. And walk-in clinics, so the conversation amongst the doctors is a vision for more walk-in availability time, and including weekends and evenings conversation, once we get to a critical mass. So the City of Cold Lake, on behalf of the MCC, has purchased some land for expansion. You can see this in yellow in the overhead screens. And we're going to go in a little bit detail of where we're at with that. So the renovated space that you see here is changed from, I kind of flipped it over and now become a new area. You can see some of the doctor kind of patients viewing areas have been removed. So that is the new space. But in order to renovate that space, we need to move the doctors to a new spot, because it's very difficult with having an Apton medical clinic and trying to renovate space with all the dust, everything going on. It's going to be a real challenge. So what we're going to be looking at is an expansion area first, move the doctors in, and then go back and renovate the space, and then provide the penetrations between the two clinics to provide the kind of the traffic movement that is going to be necessary there. So on the left is the expansion area, and you can see that each doctor will kind of have we'll call it a condo site. And they'll have their office and then 2 patient viewing areas flanking on each side of that office. So that way it's very highly efficient, and also MOA stations that are going to be positioned throughout the building in a strategic form. So this is the main level. So this just provides, we're going to go into a little bit more detail here. As you come into the main clinic to the front, there will now be a vestibule go to the 2nd floor. Now the 2nd floor is going to be, because we've already received a lot of interest in what can we do and other clinics are looking at coming to this location. So we thought we better build a second floor. So as you go up to the second floor with an elevator, we have a blank slate right now. There are individuals at this point that are looking, and that includes other medical clinics and other professionals that have provided written feedback of what they would like to see on that second floor. We have not designed it, and it's not part of the initial kind of the launch of construction at this point, just because we need to get this shovel in the ground as quickly as possible. So we'll leave it as a blank slate, at least for the original tender, and then we can maybe negotiate something if there's something that's going to come very quick in regards to timelines and schedules. As you come into the clinic, now we're back on the main floor. You can see the clinic space. I believe we have room up to, it was 28 spaces for patients for a waiting area, a washroom, and the reception area. That's in blue. And then as you go to the north, or you go kind of go to the upper part of this area, to the north, on the screen anyways, this is to the west. The MOAs, the staff, will have kind of a dedicated area for vitals, their supplies. You don't want, one of the challenges is always having some space so that way your MOAs can talk to patients with regard to, you know, what tests are going to be done, what's going to be happening, and you don't want to do that at the front counter, and that seems to be lacking in a lot of the medical clinics. So having a station in the back for private conversations to make those phone calls with patients to help the doctors with regard to making and scheduling and providing that information to the patients. And then you have the rest of the clinic space for the doctors. You'll see here that this is the condo spaces for each of the doctors. Now, the doctors don't necessarily have to have dedicated space. They are going to, because if the doctors are going to be on rotations, another doctor can fill space if they're going to be only be there part-time. So the idea is that you may have 10 spaces in the building, but you may be able to have 15 doctors as an idea, taking up all that space. So I'm trying to go as quickly as I can so I don't blow that 15 minutes. We're getting close.
You can go over 15
Two
minutes.
procedure rooms, yeah, MOA stations. The staff were involved in positioning all of this stuff in order to be highly efficient, to be able to, you know, move the patients along and get things turned over very quickly for the doctors. Staff room and training room that doesn't exist today. The pharmacy is going to be expanded for as they're looking at expansion. Their needs are increasing as the facility needs are increasing. This is the expansion area versus the renovation area in terms of elevation drawings of what it looks like. We are looking to be able to tender this project within the next month, is what we're hoping. And then right now you can see some of the investments that we're looking at. The initial investment was about $1.85 million, as I said before. The total investment of the phase one, which is kind of that expansion area, second floor shell space, is $3.4 million, and then existing renovations to that space that you see, that's the existing clinic, is about $600,000 right now. Phase three is finishing the second floor, about $1.25 million, but we don't have that budgeted today because we don't know what we're building at this point. So we just kind of left it there as an overall dollar figure. So that's about it. Sorry, I went through it very fast. You guys, it can be printed out so that way it can be shared. I wanted to go quick. Your Worship, did you want to say anything? Yeah.
Yeah, I think in summary, you know, I asked Kevin to go fast, so sorry. But you know, his passion, you know, that he'll speak for a full hour. But you know, we decided as a council that we would go all in and fund it, and then hand over the building to the MCC. They operate it on one of the slides Kevin showed. Right now, the clinic is operating cash flow positive, but remember the debt on the 1.8 that we got and the future money for the new building isn't factored in their bottom line. The city's picking that up. So the docs pay a monthly rent, and then in terms of that, we provide the staffing and all that, the supplies to run the business. So it's very easy for the docs. They are, you know, they're concerned about the price that they pay to be, you know, so we know that there's little threshold appetite for moving it up in terms of what their monthly fee would be. But the intent of the MCC is to operate it at cash flow, you know, neutral, or a little bit of profit is great if they can do it. So yeah, so if anybody has any questions, we're excited. It's really made a big difference. When we expand the building, easily we can now offer more space for doctors to come into Cold Lake, because that is the issue, is very rarely do you see doctors wanting to invest in their own building. This way they can come in, here's the fee, here's the space available, and you work as a team. We are anticipating that some of the other clinics that are located at the hospital might be interested in coming across the street and taking space up at the second level, or operating on the main level. So we're trying to build a real great relationship with everybody at the Cold Lake Hospital, and everybody working together to improve healthcare in our area. So.
Thank you. Yeah, appreciate that. Councillor Fadeev.
Good morning. Yeah, I can see it as being a center of excellence for sure. So regards to your trailblazing decisions that you guys are doing, since, I guess the shortcomings of AHS, is this a way of going down with private healthcare? Are we going down that lane in regards to some of the questions? I mean, if the model works great and your ROI on the service gets paid for, great. But what are your thoughts on that?
Yeah, I don't think we looked at it, Ben, like that. We looked at it that we desperately need doctors in our area, and so we plugged our nose, and we got involved in it. Did we want to be here? No, but we didn't see any other options, so we purchased the clinic. It was teetering on the fact that one of the doctors that was inside the building was thinking of maybe leaving Cold Lake. And so the building was on the market and nobody was buying it, because how do you make your cash flow statement if you were to purchase that building from the two doctors that were selling it based on only one doctor being inside? And so we bought it with the intent of increasing the amount of doctors coming to Cold Lake, and also being a seat at the table on recruiting. Before we were on the outside, now we're there. We have a clinic, and so when the expansion happens here, we anticipate being aggressively out there, trying to bring doctors, working with the chief of staff at the hospital to understand what they need over at the hospital for docs, but also, like Kevin said, having more GPs that are going to work from Monday to Friday. They're all paid by AHS, so in terms of when they see patients, so when they bill out, they're billing out to AHS, and so that's their business on billing. I think, though, the space around that clinic is going to attract other medical entities. We already know that there's people kicking the tire around that whole business area, commercial side, to look at feeding off that synergy there. So I think, Ben, maybe down the road that might happen, but I don't think the city itself is interested in that. We want to have a home for docs and nurse practitioners or whatever we can, because so many people don't have a doctor. And the other thing I'm sure you guys are aware of, when you phone your doctor for an appointment, you may be 30 days out, 45 days out from an appointment. And so with the drop-in clinic, the idea is that when we get there in 2026, is a person can go see a family doc right away. We've got to lower that waiting time, eh?
Yeah, thanks for that. I know seeing those names on there is pretty amazing. Oftentimes, a guy will go into emergency and then the remarks were, what is your emergency? I don't have a family doctor. Mm-hmm. And I still don't, but thanks for that. So in regards to after you see a doctor, we also are sent to, I guess, imaging or ultrasounds and things like that. What is your 5 and 10 year, expansion into? Yes, we got the doctors, but it's the testing after that is the issues. A lot of times we're three weeks, 3 months, 3 years out.
Yeah, we fully support as a council, and I think you guys do too. CGA Medical Imaging does all the imaging in the hospitals, but also has a private practice in our communities. And so one thing that we're lacking we've been championing this for a while with AHS, is an MRI machine, and we don't understand why our residents have to go to Edmonton for MRI And when you have, you know, a gifted service right here in our community that, you know, so we've been in discussions with the provider, like what would it take to get an MRI machine in Cold Lake? You know, in a perfect world, HS would put an MRI machine in the either Cold Lake or Bonnyville Hospital, or, you know, one of the communities, but I think CJ Medical is interested in putting an MRI machine in their clinic space. And I think that as municipal leaders, I think that's our role, is if private sector do want to come in and invest money, how can we help? And it's just all about providing services in our community that people don't need to go to Edmonton for. And so we are working on the MRI file, but it hasn't been easy.
I'm sure.
Yeah.
Yeah. Again, you know, thanks very much. I just had a chance to see the sports end of it. We went into Edmonton, went to emergency. They said, you know what, this is kind of beyond their scope, see a sports medicine doctor. So we got in within a week in Edmonton, and that same day we got an ultrasound done, and we were done. And, you know, I'm hoping to see that here. So
Absolutely.
thanks for all you do.
What, you know, we're one of the richest regions in the province. You know, oil sands royalty is over $3 billion a year, and yet we don't get that return on our money that we're producing in this area just on the oil, right? So hopefully HS is aware of that, and the province is going to bring money back into our area. We could have, as a council, and same with yourselves, I mean, you guys have all been great supporters of both Bonnyville and Cold Lake Hospital initiatives, is eventually you just have to say, okay, we're in the game. And that's what we did. We worked for a lot of money, but unfortunately that it is what it is, especially with today's construction costs. But it's going to be exciting. The second space is going to be free to now design, and we've got a lot, as Kevin said, we've got a lot of interest. And you know, when you look out, vision out, say 2027, I think that place is going to be huge, and it's going to be full as soon as they, you know.
Add something
Yeah.
about your worship through the councillor, in terms of the privatized, functions, that's highly regulated by Alberta Health in terms of the Alberta Health Insurance Program of what can be done in a privatized clinic. The idea of structuring of how the clinic is being designed is 2 procedures rooms, so that way if there is a doctor that wants to come in to provide, that has been regulated, that can be done privately procedures and fee-for-service procedures, it can be done within the procedures room within the clinic. And that is why we wanted to have 2 procedure rooms that are meeting those kind of the safety specification requirements to be able to deliver those services as an opportunity. Yeah.
Thanks.
All right, any other questions? Yeah. Councillor Swigert.
Yeah, it's not, well, it's kind of a comment. You know, I really appreciate what you guys are doing, and you know, you said there's no ask. I just kind of find it strange that municipality, the MD of Bonnyville, you know, that you wouldn't have had that kind of discussion with us earlier maybe, and maybe we would want to help fund it somehow, because I mean, like you're saying, it's like there's so many rural residents that rely on that kind of thing, and you know, just to me as a councillor, I'm just thinking, well, we're really not helping. I mean, we do, you know, the healthcare stuff where we invest or we put money toward the Hearts for Healthcare and that sort of thing. But yeah, I don't know. I mean, maybe there's some way we can actually help out, and that's just my comment. But maybe the rest of council will sometime agree to help out.
Yeah, I think that's a fair comment, Dana. You know, we could have came before, but you know, we're already involved with the MD of Bonnyville and ICF. And that's working well for us. So unfortunately, right now, you know, the number's grown, and so you know, the opportunity here, if you want to come in as in some capacity, I think the city's not going to, it's going to be, you know, ecstatic if you want to come in with any kind of money. But otherwise, if you feel, you know, keep your powder dry, we're comfortable with that too. We just felt that, you know, this was needed badly, and we just, it was in our strategic goals, in our top 5 strategic initiatives, and we just pursued it. And now it's become so popular that, you know, we're even looking at more land to acquire because I think it's going to grow. I think it's got a lot of potential. And with the F-35 program, you know, we're going to have a lot of people coming to Cold Lake, and we better be ready. And we stand around and we watch the feds and the province talk a lot of game, But unfortunately, if the municipalities don't do it, nothing's gonna get done, in my opinion. And I can say that because I'm leaving government, I'm leaving the politics, but, I haven't seen nothing coming from the province or the feds to our area, yet we have one of the biggest, economic impact in our area with the F-35 and what's gonna go on in the base. You have over $1 billion gonna get spent on the Cold Lake base here, and yet we have people in our community that don't have a dock. We have people going to Edmonton for services. Our ambulances are always leaving our community because everybody's going to Edmonton. And we have to improve our healthcare in our area, and unfortunately, municipalities are gonna have to do it unless something drastically changes.
Thank you. Any other questions, gentlemen? Well, thank you. Yeah, I
Okay,
appreciate
thanks, guys.
everything you guys.
You bet.
We're going to take a 5-minute break. Yeah. Okay, welcome back. We're going to need a motion to accept this presentation from the City of Coal Lake as information. Who would like to do that? Yeah, thank you, Councillor Fidesz, for making this motion that council accepts the presentation by dignitaries from the City of Coal Lake pertaining to the Coal Lake Medical Clinic Expansion Project as information. Any discussion, gentlemen, on this? Yeah, okay, go ahead.
It may be nice to not just accept it for information, but also maybe have our CAO reach out to Kevin and sort of have that further discussion on, what could we do?
Yeah,
And maybe this council's not interested, but I think they should be.
okay, thank you for that.
Thank you.
Councillor Fidesz?
Yeah, I'm total agreement. The only thing that's kind of questionable is, this is an MCC. It's not just a partnership with Coal Lake, so I'd like to find out what the, nuances are of that, right? So,
Okay, I talked to Mr. Nagoya to get a hold of Ben here and we're gonna have a discussion about this for sure. I think it's very important in our area. Thank you. Any other discussion, gentlemen? Okay, I'm seeing none. I'll call for the vote. That's carried. Thank you. On to number 8.1.
Good morning.
Good morning.
Administration is presenting subdivision application 2025-008 for council consideration. The applicant is proposing a boundary realignment of Plan 072-2411, Block 1, Lot 1, to create a 23-acre parcel from agricultural quarter section Northwest 2061 for West the 4th Meridian. I would like to let council know that Wanda is in attendance today. If you do have any questions for her, she'll be more than happy to respond. Notification of the proposed subdivision was sent to referral agencies and adjacent landowners with a deadline of May 14th, 2025 for submitting concerns to be considered at the June 10th council meeting. No concerns have been received regarding this application. And if I could just get you to bring up the map, please. This application proposes a boundary realignment to create a 23-acre parcel as shown on the map above. The subject site is located along Range Road 445 and south of Township Road 614, northeast of Fort Kent. The application for a 23-acre subdivision does not comply with the municipality's land use bylaw, section 69.4 BI, or the 4 parcels or less total maximum of 20 acres subdivided from quarter section that is not fragmented. However, within the Municipal Government Act, section 6542A, the proposed subdivision would not unduly interfere with the amenities of the neighborhood, or 2, materially interfere or affect the use, enjoyment, or value of the neighboring parcels of land. And to align with good planning practices, it makes sense. Therefore, it is recommended that the proposed subdivision be approved as per the Municipal Government Act, section 6542A. The proposed subdivision would not unduly interfere with the amenities of the neighborhood, nor materially interfere or affect the enjoyment or value of neighboring parcels of land, and to align with best practices with the following conditions. Pursuant to section 655, that all approaches, culverts, and internal roads be installed. Number 2, that if the subdivision is to be registered through a plan of survey, that the owner developer dedicate to the municipal district of Bonnyville the 17-foot strip of land for road widening along the entire frontage of the west side of the proposed and remnant parcels to be registered by separate road plan. Or, if the subdivision is to be registered by descriptive plan, the caveat registered is instrument number 072-162-465 for a 17-foot strip of land for road widening along the entire frontage of the west side of the proposed and remnant parcels shall remain on titles. Number 3, that the existing lot described as 027-2411 Block 1, Lot 1 be consolidated with the proposed area prior to registration of the new parcels. Number 4, that a real property report be obtained. Number 5, that the sewer disposal shall comply with the Alberta Safety Codes and the Province of Alberta Public Health Act. And number 6, that all outstanding taxes to be paid. Any questions?
No questions. Councillor Crick, maybe.
Not a question, just a motion. It makes sense looking at the map there. It's bush on that strip there, so it totally makes sense, I think, to do this. So I'll make a motion to approve it.
Okay. Thank you, Councillor Crick, for making this motion. The council approves subdivision application number 2025S008 for boundary realignment of plan 0722411 Block 1, Lot 1 to create a 23-acre parcel from agricultural core section northwest 2061-4 west of the 4th M for 1 acre as per the following conditions, 1 through 2 below and then 1 through 4 below that. Any discussion on this motion, gentlemen? Okay, I'm seeing none. I'll call for the vote. Are you in favor? Yes, he is. That's carried. Thank you. Have a nice day.
Thank you, gentlemen.
You're welcome. On to 9.2.1.
Morning, Council.
Morning.
So what we've got today is a terms of reference amendment. Oh, hang on one sec. Sorry about that, we're on the wrong one. Surveillance system policy, policy number C5C.021. Administration has prepared a draft policy to address use and access for records created by surveillance systems installed in the MD Bonnyville facilities and on municipal property. It states that with the increase in theft and vandalism over the last several years, the MD made the operational decision to install additional surveillance systems on municipal properties to help protect its assets and infrastructure. As a result of this increased use of surveillance, administration has drafted a new policy in recognition of the importance of ensuring surveillance data is managed securely, consistently, and in compliance with legislation, with increasing emphasis on the use and management of electronics, data, and records. It's essential to have clear guidelines in place for MD staff to safeguard sensitive records and prevent misuse or unauthorized access. This policy will support the MD in maintaining proper records management practices, ensuring that all surveillance data is securely stored, organized, and accessible only to authorized personnel. This will enhance accountability, protect personal privacy, and reduce the risk of data breaches, fostering trust within the community while protecting the integrity of the MD's operations. The Committee of the Whole reviewed the proposed new policy on May 20th of 2025, and they recommended adopting it as presented. Attached for Council's review is two appendixes. One is the actual policy, C5C.021, Surveillance System Policy, and also the Law Enforcement Disclosure Form for requesting information. There's no reference to provincial or federal legislation or the strategic plan. No cost incurred as resulting from this policy change. And if adopted by Council, a new policy will be posted on the MD website. Administration is recommending that council adopt the new policy C5C.021 surveillance system policy as recommended by the committee of the whole. Take any questions
Thank you.
that may have.
Any questions, or someone like to make a motion? Counselor Fadеев? Okay, thank you, Counselor Fadеев, for making this motion that council adopts the new policy number C-5C.021 surveillance system policy as recommended by the committee of the whole. Any discussion on this motion, gentlemen? I'm seeing none. I'll call for the vote. That's carried. Thank you.
Thank you.
Thanks. Have a great rest of the day. On to 9.2.2. Good morning.
Administration is presenting the MD Agricultural Service Board Terms of Reference Amendment. The Agricultural Service Board Terms of Reference was reviewed by the Agricultural Service Board on March 27, 2025, as per five-year review process. Administration has prepared an amending draft for council's consideration. Sorry.
It's on now.
The proposed
Thanks, Steph.
amendments for the Agricultural Service Board Terms of Reference has been put forward to align with the Terms of Reference with the Boards and Committees Bylaw Number 1748. The Committee of the Whole reviewed the amendments on May 20th, 2025, and is recommending that Council adopt the amended policy as presented. Attached for review is Appendix A, Agricultural Service Board Terms of Reference amended. Administration's recommended action would be that Council adopts the amended Agricultural Service Board Terms of Reference as recommended by the Committee of the Whole.
Thank you. Any questions, or anyone like to make a motion? Yeah, thank you, Councillor Kraviak, for making this motion. The council adopts the amended Agricultural Service Board Terms of Reference as recommended by the Committee of the Whole. Any discussion on this motion, gentlemen? I'm seeing none. I'll call for the vote. That's carried. Thank you.
Thank you.
Have a nice day. 9.3.1.
Good morning.
Morning.
Administration has reviewed the antenna system siting policy as required every 4 years and is presenting amendments to improve consistency with our policy formatting, definitions, grammar, and terminology. The policy was created in 2018, amended in 2019. The origin of the policy is to provide guidelines to communication tower developers in choosing locations and reducing potential conflict. The edits presented are administrative in nature and do not alter the intent of the policy. Amendments of policy number 3A.009 were presented to the Committee of the Whole on May 20th, 2025, who recommended council approval. Administration recommended action that council adopts amended policy number 3A.009, antenna system siting policy as recommended by the Committee of the Whole. Any questions?
Thank you. I don't see any. Would someone like to make a motion? Yeah, Councillor Crick, thank you for making this motion that council adopts amending policy number C-3A009, antenna system sitting policy as recommended by the Committee of the Whole. Any discussion on this motion, gentlemen? I'm seeing none. I'll call for the vote. That's carried. Thank you.
Thank you.
Have a nice day. On to 9.4.1.
Good morning, Council.
Morning.
Today I bring to you, Council, a 2025 operating budget amendment. Administration brings for Council's consideration amending the 2025 operating budget for the Council grants to individuals and non-government organizations, increasing the existing budget by $50,000. This report for Council's consideration is an action item resulting from discussions between Council and Administration on the budgeted amount for Council giving that may have been underfunded. Council strategic goal number 1, that's the strategic plan that it fits under, building a viable and diverse regional economy. The funding, the increase to the budget, which is General Ledger 2770 621001, would be funded from the cash flow reserve. So administration's recommendation is that Council approves amending the 2025 operating budget by increasing the grants to individual and non-government organizations budget by $50,000 to be funded from the cash flow reserve.
Thank you. Any discussion or anyone like to make a motion on this? Yes, thank you, Councillor Swigert, for making this motion. That Council approves amending the 2025 operating budget by increasing the grants to individuals and non-government organizations budget by $50,000 to be funded from the cash flow reserves. Any discussion on this motion? Okay, I'm not seeing any. I'll call for the vote. That's carried. Thank you. And then we have a 9.4.2.
Thank you. This is titled Policy Number C-2B.033, Disposal of Assets Policy, and it's an amendment. Policy C-2B.033, Disposal of Asset Policy, is a policy to establish principles for the disposal of tangible assets to ensure the program is executed in a transparent, cost-effective, and practical manner. Administration is recommending, as attached in Schedule A, the policy be amended to 1, include the sale of vehicles and mobile equipment to another municipality or local nonprofit or service organization as approved by the CAO, and 2, to include donating small equipment and materials to other municipalities as approved by the CAO. There may be scenarios that vehicles, mobile equipment, small equipment, and materials may be of interest to another municipality or local nonprofit or service organization. This revision would allow the option of disposing the asset directly to the municipality or a local nonprofit service or organization. So administration recommends that Council adopt the amended policy number C-2B.033, Disposal of Assets Policy, as presented.
Thank you. Looking for a motion or a discussion? All right. Thank you, Councillor Fadeev, for making this motion that Council adopts amending policy number C-2B.033, Disposal Asset Policy as presented. Any discussion? Yes, Councillor Crick.
Yeah, I'm just trying to look through here quickly because I was just handed this morning and didn't have a chance to go through it ahead of time. Is there a dollar value that's attached to this, like to what would be donated? I'm just curious, like, is it $1,000, zero, like something that's completely worthless, or?
Through the chair to Councillor Crick, are you asking about, is there a number that's attached to this amendment? Like if we were going to direct sale to a municipality?
Yeah, well, it's talking about the CAO can donate to another municipality, right?
Okay. Yep, through the chair to all of council. Basically, the policy as it stands right now is still the policy in play. Really, the only thing that was missing was if a local municipality saw that we were disposing of an asset, whether it was a vehicle or what have you. As of right now, we could not sell directly or present to council whether council wants to sell directly to another municipality, whether it's a vehicle or what have you. From administration standpoint, we believe that was missing. That should have been in the original policy. So the dollar amount that would go, that would still fit in regards to having to comply with the policy as a whole. Okay. So, you know, if the vehicle was $10,000 worth $10,000 and a municipality wanted to direct buy it, well,
Okay.
then this would allow this to be considered.
Okay, that makes sense. Thank you.
All right, thank you for that, Councillor Crick. Any other discussion? Okay, I'm not seeing any. I'll call for the vote. That's carried. Thank you.
Thank you, council. Have a good day.
Yeah, you as well. Thank you. On to 9.5.1.
Good morning, Council.
Morning.
I have policy number C-2A.061, Asset Management Policy, and it's a new one. Administration has prepared an asset management policy to guide the development and implementation of the MD's asset management program. The MD strives to ensure effective and efficient asset management in compliance with relevant legislation and applicable strategic objectives and plans. This policy demonstrates the MD's commitment to best practices in asset management, formally links asset management to organizational strategic objectives, and supports the delivery of sustainable community services in the short and long terms. Attached for Council's review in Appendix A is the policy, C-2A.061, Asset Management Policy. Reference to the strategic plan is goal number 1, building a viable and diversified regional economy. The objective, create a municipal financial sustainability plan. And action 4, develop an active asset management program. There are no cost implications associated with this recommendation of implementing the policy. Communication will be via the MD website. And it's administration's recommendation that council adopts policy number C-2A.061, asset management policy, as presented.
Thank you. Looking for a motion, gentlemen? All right, Councillor Fadeev. Thank you for making this motion that council adopts new policy number C-2A.061 asset management policy as presented. Any discussion? Okay, I'm seeing none here. I'm going to call for the vote. That's carried. Thank you.
Thank you, Council.
Yeah, have a great day. On to 9.6.1.
Good morning.
Morning.
We have for council the policy number 1.001, council meeting entire policy amendment. Administration has prepared amendments to this policy for council's consideration. Policy number 1.001, council meeting entire policy, was last reviewed by council in 2020 with all council policies as a bundle when they were reformatted and came up for scheduled review again in 2025. During this review, administration drafted proposed amendments to the policy, which would add clarity to the expectations of council attire at meetings of council. Other amendments are to match updated formatting for municipal policies. The Committee of the Whole reviewed the proposed amendments on May 20th and are recommending that council adopt the policy as presented. The drafted amendments are available in Appendix A, and administration's recommended action is that council adopts the amending policy as recommended by the Committee of the Whole.
Thank you. Looking for a motion, gentlemen. Thank you, Councillor Swaggart, for making this motion. That council adopts amending policy number C-1.001, council meeting attire policy as recommended by the Committee of the Whole. Any discussion on this motion? I'm seeing none. I'll call for the vote. That's carried. Thank you. On to 9.6.2.
Next, we have policy number C-2A.034, electronic signatures policy, which is another amendment. So administration has prepared this amending draft of the document for council's consideration. The current policy only allows for secure electronic signatures to be used on legal instruments with CAO approval. The proposed changes to this policy will help reduce red tape for the EMD staff by allowing for the use of secure electronic signatures without CAO approval, provided it is in accordance with current federal, provincial, and municipal legislation. Section 213 of the Municipal Government Act allows for the reproduction of signatures, including the use of electronic signatures if authorized by council. The Committee of the Whole reviewed the proposed amendments on May 20th and are recommending adopting the amended policy as presented.
Thank you. Looking for a motion? Thank you, Councillor Crick, for making this motion, that council adopts amending policy number C-2A.034, electronic signature policy as recommended by the Committee of the Whole. Any discussion on this motion, gentlemen? I'm seeing none. I'll call for the vote. That's carried. Thank you. On to 6.3.
Next, we have Committee of the Whole Terms of Reference amendments. So the Committee of the Whole reviewed the current terms of reference for its annual review and are recommending amendments with respect to the chair for meetings to improve clarity and meeting efficiency. Administration is presenting these amendments for council approval. Proposed amendments will help clarify how to proceed when the chair is unable to attend a meeting and improve efficiency by designating the reeve as chair in the deputy reeve's absence, but maintaining the current process as a backup in the event it is necessary. The committee reviewed these amendments in May and are recommending adoption of the amended terms as presented.
Thank you. Looking for motion, yes? Yes, Councillor Kraviak, thank you for making this motion that council adopts amended Committee of the Whole terms of reference as recommended by the Committee of the Whole. Any discussion, gentlemen, on this? Okay, seeing none, I'll call for the vote. That's carried, thank you. On to 6.4.
In March 2025, the Alberta Bilingual Municipalities Association reached out to the MD of Bonnyville with a proposal to implement annual membership fees and have requested feedback from participating municipalities. At the April 8th regular meeting of council, administration was directed to respond to the proposal, requesting more clarity with respect to the proposed fee structure and benefits to members. On May 26th, the MD received a response from the association with additional information. The annual membership fees proposed by the association are included in the letter attached as Appendix A. The annual fee that would be applicable to the MD is the municipal district/county's fee, which is $1,100. And my apologies, I think that letter is actually attached as Appendix B in this report. The MD has been a member of the association since 2020 and it has one representative position on the board, with the current appointment being Deputy Reeve Scarson and Reeve Kolinsky as the alternate for a 4-year term expiring this October. Attached in Appendix A is the response letter from the association, and Appendix B is the initial proposal letter as well as the MD's response to that. Administration's recommended action is we're just looking for direction from council today in terms of how to respond to their proposal.
Okay, Councillor Fadeev.
Yeah, I think still the rates are kind of not right. So if you're an MD or a county, you have to pay $1,100. If you're a town over 2,000, it's $700. You're looking at the county of St. Paul only has about 6,300 people that they have, and they have to pay way more than a town of the same amount. I think this is like an overlapping service, and to me, it just doesn't make sense to support this at all.
Okay, thank you. Councillor Crick.
Yeah, I agree. If there's no benefit to us, then I think we just drop it altogether.
Okay, thank you, Councillor Crick. Any other discussion, or someone like to make a motion? Excuse me. What's that? Councillor Crick?
Yeah, I'm just reading the motion here, that proposal providing the following reasons. I think we just make a motion to not fund it anymore. We're not, I thought we were funding this, were we not? Oh, okay, so just.
Through
carry
the
on.
reeve to council, there is currently no fee for, they're proposing implementing a fee and looking for feedback from the participating municipalities.
Okay, sorry, I might misunderstanding then.
Okay, Councillor Swaggart?
Yeah, the letter there, yeah, it's unfortunate that you didn't know that we weren't paying anything. So if you don't want to fund it, that means, I guess, we are not part of it. So I don't know, I thought there was benefit to it. And I don't know, maybe Councillor Scarson wants to say that there isn't, or there is, because he sits on the board, but I don't, you know, to me, maybe it's a bit, well, it's not a lot of money, it's $1,100 a year, but if it's a money thing, then we can maybe negotiate it, but I don't think it's a big deal that we're part of it. Yeah.
Deputy Reeve? Scarson?
Yeah, I do sit on it, and I've been to a few meetings, and quite honestly, if it's a free committee, it's probably fine, but the pay structure doesn't really make sense that we would pay more than, let's say, the town, for example, but I don't know, I sit on it, but I'm kind of torn. I don't know if it's necessary that we have a member on there or not. Part of the, some of the meetings are in French, so I don't even know what they're talking about half the time, so it's, yeah, I don't know. I can go with whatever council agrees on this one, so.
All right, thank you. Any other discussion? Or someone likes, Josh, you want to make anyone like to make a motion? Or? Oh, sorry, I got to turn you on. Go ahead.
I can make the motion, I'm just not sure how to word it, that's all. I guess just that we're in opposition to, yeah, we're in opposition to the fees, and we can carry on as is, but we're not interested in paying a fee.
All right, so this is your motion?
Something like
All right.
It could just be that they would respond in opposition to the proposed without, if it's an overarching opposition.
Because there is a favor and opposition, so we can just put an opposition on the, correct?
That's correct.
Are you okay with that?
Yeah.
All right, thank you. Councillor Fadeev?
Yeah, when they, first asked everybody to join, I kind of seen it going towards a fee, right? It's, 4 years ago, they're gonna run this, and then, it's nothing, then they're gonna ask for it. It's just structured wrong. But if it's an overlapping service, I mean, we still service the bilingual, associations that we have here all the time. So it's not as if we're not supporting a certain group at all, but I think this is just certain structure is unfair, and I think if we come up with nothing, we're just gonna come back, this is gonna come back to us again. We just need to make a decision of some sorts.
All right,
I can see it coming back.
okay, thank you. Any other discussion? All right, thank you, Councillor Crick, for making this motion. That council directs administration to respond to the Alberta Bilingual Municipalities Association proposal for implementing annual membership fees in opposition of the proposal. Any discussion on this motion? Okay, I'm seeing none. I'll call for the vote. That's carried. Thank you. 9.6.5. Who would like to start?
Administration will call up communications, please.
She's on her way with Esso. Here she comes.
This is my first time with this new system, so Bear with me.
Good morning.
Good morning. In front of you, you have our quarterly report for the first quarter of this year. I'm just going to do a couple of highlights from that report. We completed the printing and mailing of the 2025 Adventure Guide. The guides are actually going out to the visitor information centers across the province today. We welcomed a new team member, Maverick Best. He is working primarily with Parks and Kinnessoo to run their social media, marketing, and other communications.
What's his name?
Maverick Best.
Real Top Gun.
We attended 2 trade shows in cooperation with Go East of Edmonton, of which we are partners. The Edmonton RV Show and the Calgary Outdoor Adventure Show, both were very well attended, and we thought we had good presence there. And if you've been through the front doors of council chambers, you've seen our new trade show booth that we designed for this year. We'll be using it at the oil and gas show next week, as well as trade shows next year. As always, we produced a few copies of the resident newsletter, Rural Review, and had those distributed. When it comes to social media, we had, over the first 3 months of the year, we had 5 really well-performing posts. As you can imagine, because of going into camping season, most of them had to do with our MD campgrounds and the reservation systems. The other one was CAO Ben Berlingnet accepting a plaque acknowledging the MD's cooperation with the Cold Lake Ag Society. The summer jobs at TNU, we did a post specifically for those positions that were open seasonally this year. A small video, a short video about the snowplow lineup during our last big snowstorm before they went out and hit the roads. That was a very popular post. And then also Ag's a spring workshop that they held about building bee houses and planting shelter belts. For the website, our page views were just over 97,000, which is pretty good. That's, again, a lot of that is traffic going to the MD campground pages where people can find out information about coming camping in the MD of Bonnyville. And the seasonal hiring portal, which we worked with HR on to create an easier process for people to apply for seasonal positions. So that was one of our biggest things. Do you have any questions?
I'm sure we do. Let's start with Councillor Crick, then Councillor Fadeev.
All right, thank you. Thanks for all the work you do. My question is kind of a bit of a financial one, but you mentioned a new team member.
Yes.
And I'm glad that departments are working together.
Yes.
I'm just curious if it you said working primarily with Parks and Rec, so will that show up on the Parks and Rec part of the budget, or does it show up on the marketing communications?
Through the reef,
Yeah.
to the councillor, it comes through the marketing and communications budget. It had been originally kind of separated out where it was a 50-50 split, but we decided to bring it completely into our department to streamline everything and make it consistent across the board.
Okay, so when we see the numbers for the, the campgrounds and Parks and Recreation, there is some other costs than that the municipality has from other departments that are going towards that, or am I right in saying that?
It's just the advertising that's always been there. It's just
Okay.
that now we have, it was a previously approved position, but we've just brought it into the marketing
Okay.
department.
Okay, thank you.
You're welcome.
Thanks, Councillor Fadeev.
Hi, thanks. Are you guys, so first of all, I really like the top meta post, so we can kind of see what are the top hits. Second question is in regards to economic development. How is your department supporting them in spreading out the good news about economic development, either on LinkedIn or, I think that's pretty well the driver there.
Through the Reeve, that's a really interesting question and quite timely. We actually met with our economic development officer yesterday, and we are coming up with campaigns to really push, especially the business visitation program, out on LinkedIn. And we are working with them to modernize their newsletter as well, and we're moving forward in evolving that program a lot.
Yeah, because I find we're just missing the boat when it comes down to LinkedIn and our presence there.
Oh.
As far as economic development as well, right? So.
I think maybe it's because I've focused mostly on this because this is where we spend most of our, that's where we spend our advertising budget socially, but I can include LinkedIn in there next time for sure.
Okay, thanks.
Okay.
It's like you knew that question was coming or something.
No.
All right, any other questions? All right, thank you.
Administration would like to call up customer services, please.
Good morning, Mr. Reeve and Council.
Good morning.
So this is the Customer Service Quarterly Report, first quarter report. Our automated phone system, it is still successful. It provides us extra time to help out with other departments and I guess cross-train and learn from other people, so that's helps us at the front too. Then we can go to senior transportation grant. So we're still seeing an increase from the first quarter in 2024. And I think that going to events like our senior registration event that we went to last year kind of gets the word out a little bit more. So then we still have some seniors saying that they don't really know about the program. So I think that's helpful. And then we can just go to the Ardmore landfill one. Thank you. So I guess there's kind of been a little bit of a decrease. It's kind of steadying out, but we do have quite a few Ardmore landfill cards. Like when I did this report, it was like 1,700 cards roughly that have gone out, and about 250 Cold Lake cards, and about 380 cell phone app applications ones. So, yeah. Any questions?
I'm sorry. Councillor Fadea, I think he has a question midstream here.
Yeah, thanks. Senior transportation grant. I totally understand Edmonton, but just surprised to see Tollfield on there. What kind of medical services are in Tollfield? I just seen it and I'm like, interesting.
I would have to get back to you on that. I'm not sure what.
It's more curiosity than
where
anything.
They went.
Family doctor.
Yeah, as a family doctor, who knows, right? But yeah, no, it's just interesting. Okay.
I'll get back to you.
I'm interested too.
Okay. Thank you.
So, is there still a lot of seniors that have no idea about this program? Because I do get the odd person, and then I refer them to you guys up front. And like how often does a senior come in here and ask questions, or someone that has a parent that comes in to ask questions about on behalf of their parents?
Yeah, it is often that we do have somebody, like I'd say a couple times a month for sure.
Okay.
That people are still learning about it. And I think that some of them are spreading the word too.
Okay.
So I think that's good, but yeah.
How about on the rural review? Have we ever had a segment on that, Trace? That'd be nice to add that in. Yeah, okay.
Yeah, good morning, Worship and Council.
Morning.
Reeve. Yeah, we do have quite a few inquiries regarding transportation seniors. I've been working with FCSS as well, as people are looking not only for medical appointments, but just general transportation. So at our next interagency meeting, I will be bringing that up, and then looking at the streams available for alternative transportation as well.
All right, thank you. Was that it for your presentation?
Yes.
Oh, any questions, gentlemen? Any other questions? Great job, thanks.
Thank you.
Administration would like to call up lead services, please.
Hello again.
All right.
So I'll be really quick with our report. There were 7 bylaws in draft, either under review by their respective departments or finalized and pending readings by council. 11 bylaws were passed and 5 repealed during the first quarter. For policies, there were 15 new and 12 existing policies in draft or under review for council consideration at a future meeting. 5 new and 5 amending policies were reviewed and adopted by council. At the end of the first quarter, there were still 3 policies pending review by administration. Under other, we have a few updates for our department. We coordinated a total of 9 public hearings and delegations to council during the first quarter. Our department closed out 1 FOIP request received in the fourth quarter of 2024 and did not receive any new requests during the first quarter. Communication continues with partner municipalities for the Joint Assessment Review Board and Intermunicipal Subdivision and Development Appeal Board to bring everyone into compliance with the requirements of the joint board agreements. Preparations and planning for the 2025 municipal election are ongoing. We have started finalizing product designs, getting quotes, and ordering materials for supplies. The substitute returning officer and I are very fortunate to have been able to have attended a training session, which was hosted by the City of Calgary in February during a school division by-election. It was a really great opportunity for us actually to see the operation on a much larger scale and get insight and ideas on how we can make improvements in our processes. We have also been busy preparing updated correspondence for the website and candidates guide. Just, I believe in the last couple of weeks, the most recent changes to the provincial legislation have been passed. So now we're just working on updating all of that communication and getting that pushed out to our residents and any future potential candidates for the election. That's it for my report.
Thank you. Any questions, gentlemen? Okay, thank you. That's it? All right. Looking for a motion? Thank you, Councillor Kraviak, for making this motion that council accepts the CEO Office 2025 first quarterly report as information. Any discussion? I'm sure there's none, so I'm going to call for the vote. That's carried. Thank you. On to number 10, I think, or did I forget something? Nope, number 10.
Good morning, Reeve and council.
Morning.
I'd like to bring to your attention correspondence and information. We have 12 items. I'd like to review 2 of the 12 items. If I may, 10.11, email for municipal assessment and grants, budget 2025-2026, grants in place of taxes. And I'd like also to review again, item number 10.12, Bonneville employees retirement announcements. We heard earlier before council started that the announcement of Shannon. Again, 20 years in GIS coordination. We truly will miss her, but we have a very talented person stepping in. Addition to that, Sandy is now retiring after 19 years, and she's in the Environmental and Protective Services Administration Assistant. We also miss her, and Matt will miss her too. That is my information under correspondence and information.
Okay, thank you. Any discussion or any questions? Okay, I see none. Just looking for a motion then. All right, thank you, Councillor Kraviak, for making this motion. The council accepts the following correspondence as information, 1 through 11. Any discussion on this motion? I'm seeing none. I'll call for the vote. That's carried. Thank you. Just looking for reports from members of council now. So whoever likes to start, go ahead. Councillor Crick.
All right, thank you. I apologize in advance. I have a little bit of a longer report due to being at FCM.
Okay, that's it.
Okay, thank you. So, I did attend after our last council meeting, I went to Cold Lake, kind of caught the end of the town of Bonneville, the Bonneville District Chamber of Commerce and the Cold Lake Chamber of Commerce work together and they were hosted a gathering for business leaders to come and help them get the security clearances they need to get to work on the base. So it looked like there was a lot of businesses there, really good event they put on. I just caught the tail end of that one. And then went to FCM the next day. So to start off with, got to Ottawa, and there's I don't know if whoever's been there, there's a kind of a torch thing, a fountain with a torch in it, and sitting right in front of the Parliament buildings. And so people sometimes throw coins in there. So my wife told me not to do it, and some other guy was shaking his head, but I had to reach in and grab a quarter out of there. And I told her to take a picture of me doing it, and she says, no. And the other guy, I said, well, the reason I'm doing this is because it's about time some money goes from Ottawa back to Alberta.
Oh, boy.
So this quarter will be donated to a local charity, and that's why it's here. The next day we got a thank you to Dana for organizing it with MP Layla Goodridge. We got a tour of the Parliament buildings and also got to sit on a question period. The Conservatives were raising a lot of questions to the Liberal Party about raising spending by 8% and, of course, not tabling a budget, which I would like to see them table a budget myself. Then in the Prairies and Territories Caucus meeting, they were talking about the Green Municipal Fund and projects that were funded, but it seemed like the rural projects got a very small percentage of the funds from that. Most of the Green Municipal Fund projects went to the big cities. Got to hear the Prime Minister speak. No, sorry, that's coming later. The MC, she started off and she said, you're going paperless this year, so we didn't have any kind of program. It was all on your phone. And she says, but I'm not. And she had her paper notes in front of her. So I thought that was kind of interesting. I'm going to skip that part. Someone spoke about, there was a speaker there who spoke about tourism being the #1 economic activity in Canada by 2030. I'm not sure if it'll surpass oil. There was a lot of talk from different speakers, from the CEO as well, about the Liberals' tariffs, or not the Liberals' tariffs, Trump's tariffs, making life more unaffordable for us all. I thought it was kind of ironic, though, that none of them mentioned, they all talked about the tariffs, but none of them mentioned that the spending the Liberal government did over the last 10 years and how that caused our own inflation and made stuff very unaffordable. Yeah. Then the CEO there, she had a kind of a fireside chat with the Prime Minister and didn't really ask him any tough questions. So I did get to talk to her afterwards, and I told her I wish she would have asked him if he was going to present a budget, because it's kind of random to run a country without a budget. There was, they had a mayor from New Orleans speak, and he said that he thanked the Canadian government for paying for a mural to highlight French culture in the city of New Orleans. Again, I was wondering why is our money going way down there? The Prime Minister talked about starting, because Mark Carney, he gave a speech there, he talked about starting an organization called Build Canada Homes. He said he'd put $25 billion towards low-cost housing, but never said where the money would come from. But I guess if you don't have a budget, you can just print whatever much you need or borrow it. He said also that he would work with municipalities to cut development costs by 50% for multi-unit housing projects, and that the federal government would make municipalities whole so they didn't have to bear any of the costs from cutting development costs. But again, failed to say where that money would come from. And I just put my own notes in here. I wondered if it would come from more debt that causes more inflation, or maybe from the Liberals' tariffs on electric vehicle batteries that are reducing farmers' canola prices. And it's interesting that the Liberal government put those tariffs on before Trump ever talked about putting tariffs on. The Prime Minister also talked about $4.5 billion into a housing accelerator fund. And he talked about building high-density homes, building to scale with consistent specs, building modular prefab. And he stuttered a lot in his speech. He was very vague, like it was almost, I talked to other people in the room afterwards and people are like, what was the guy talking about? But from basically what I can gather and talking to some other people, you know, from our RMA zone that I kind of knew, it sounds like he's talking about building very small to scale, like repetitious mass producing kind of housing to try and deal with the housing. So to me, that sounded like communism. He mentioned new trade and energy corridors subject to the agreements. That was his wording, subject to the agreements. But he didn't really get into what that meant. But in listening kind of, you know, in my own question period in the parliament there, it really sounds like he's hoping to build new trade and energy corridors as long as everybody agrees, the First Nations, all the premiers of the different provinces and stuff. So essentially, as far as I can see, probably no corridors. I had a good conversation with Barry Bruce, one of the councillors from Beaver County. He was telling me about some healthcare issues. And it just so happened that Adele Richardson from Cold Lake was sitting across the table, and she's a manager in AHS in some capacity. So I got up and said, hey, come sit beside this guy. So she came and sat beside Barry Bruce and was able to kind of help him with his concerns. Also met a company called Sprung Structures. They work with they have another company they work with, but they build pools, swimming pools. And it looks like they can do them for quite a fraction of the cost. So I thought that might be worth looking into. They did I think a 6-lane pool, or it was an 8-lane pool, 8-lane by 50 meters, which is twice as long as what the town is right now. And a separate warm-up pool and a pickleball court. And they did it all for $16 million here just a couple years ago. So it might be something worth looking into. The Green Party leader, Elizabeth May, she spoke and she did a land acknowledgement and thanked the Indigenous people for being patient with us as we live here. She said that we should talk about giving the land back, but she said that's a conversation for another time. Melissa Lansman, she was with the Conservative Party. They had different people from each party give a keynote speech, and she spoke. She talked about the government should get out of the business of building houses and let the private sector do it. Then they had an NDP guy speak, and I'll summarize. He basically said the government should pay for everything because nobody can afford anything without the government paying for it. That's my paraphrase and summary. And then in the resolution session, I had moved an amendment to take out the word climate adaptation and mitigation out of one of the resolutions, which ended up only getting 16% support. But I think it's important for them to know that not everybody's all for this kind of crazy climate action they're calling for. And then after I got home, our representative on FCM from our RMA district is Mike, I can't remember his last name, from Wainwright, one of the councillors from County of Wainwright. He gave me a call on the 3rd of June, just looking for feedback, how it went. So I had a good conversation with him, and I think he's doing a really great job. And then, so that's it for FCM. Then I was able to attend the Bonnyville Seniors 50th anniversary, and Barry gave a great speech. We sat at the same table as Willie McGregor, and I wish I could speak as good as Barry. And Barry said in his speech there, he said he wished he could be the man. I don't know how he worded it exactly, but something, wish you could be the man that Willie is. And I was thinking, you definitely are, and you're a great man that a lot of people look up to you. So,
Thank you.
Just about done here. Sorry. Also went to the Goodridge Firefighters Recognition, Recognition Evening. Somebody got a 20-year award. Someone else got a 25-year award. And then I presented at the on Thursday last week at the Electoral Boundaries Commission in St. Paul. That's for the Alberta electoral boundaries. So they were quite surprised. The commission was quite surprised to hear that 30% of the oil royalties in the province come out of the MD of Bonnyville. And I explained how, for effective representation, they need to look at more than just population. They need to look at the size of a lot of the rural ridings, and how it's a couple hours to go across our riding. I said that we get, a third of the royalties come out of this MD, and we don't have a single overpass. And they asked me, well, do you guys need overpasses? And I said no, but we sure could use our highway fixed up. I said, if you see somebody driving straight on Highway 28, they're probably drunk because they're not swerving around all the holes. The MLA was there to hear the comments. And yeah, there's actually just ended up being the only two presenters were our MLA and myself. I was surprised that nobody from any of the other counties or municipalities were there. And that's it for me. Thanks. Sorry about the long report.
That's all right. Thank you. Councillor Swigert.
Yeah, thanks, Josh. You said lots, and it was good. And I'll just shout out to Layla Goodrich, because she did accept us fairly easily and took us on a tour through question period. And I just wanted to mention, you know, it's always question period. There's never any answers given. But one of the things that really got me was the Liberal government was asked about bail reform and, you know, the revolving door with criminals, because they know it's an issue Canada-wide. And they responded and said, well, there's laws that we have to follow. And then the opposition went nuts and bashed them and said, well, you're the government. You can change the laws. So everyone's been waiting for Trudeau to be gone so that we can actually change or have bail reform. So I think we're really looking forward to that. I did attend a bail reform session at FCM. They had some high-ranking police and RCMP there, and they said they can't change the system, but like FCM can lobby the government and make changes, or get the government to make changes. So I'm hoping that FCM does that. Yeah, it was an interesting forum on bail reform. They said nothing that we haven't heard before, though, so a bit disappointing. So anyway, that's it. Thanks.
Thank you. Deputy Reeves, Carson.
All right, yeah, so I was at FCM as well. That was the second FCM I attended in 8 years. I went to the first one in my first term and the last one in my last term, and I don't think I missed anything in those other 6 years. It was, to me, it was, I don't say pointless, but it was, I don't think it was very informative, to be honest. And, you know, the theme, there was definitely some themes, like Josh had mentioned. They talked a lot about climate adaptation. That's the new word, I guess, right, for it. And then I did listen to Elizabeth May. She's actually pretty charismatic when she talks. That the one good thing I thought she said was that we really need to work on. We're all worried about external enemies, but we do nothing about internal enemies, right? And we really need to focus on how Canada can work as one instead of against each other, right? And I hope it looks like they're doing some stuff to alleviate that. But I was at question period as well with, but I got to go there with Shannon Stubbs, and she took us for a bit of a tour. We met a couple other MPs and stuff. The one telling thing I thought for me for that was I did hear one guy from the Bloc Québécois refer to Alberta's oil as dirty oil during question period, so that is still out there. I really feel like that, you know, we're not going to get away from the climate change activists and all that, but what we do need to do, I think, is convince the rest of Canada that Alberta does produce clean oil and ethical oil, which isn't happening in other places of the world, but we're still buying it from other places in the world. And we, you know, the one FCM that we could make a difference in could be next year when it's in Edmonton. And I think there's lots of things we need to lobby our reps to do for the one in Edmonton, because it's even different than the one in Calgary, because we have, you know, industry right there, right inside the city even, that I hope a lot of these guys get to see. So that might be the one FCM that is actually worth going to and being a part of, right? So we'll see how that one plays out. The other one with FCM was I did go to a few workshops, but I went to one about AI in municipalities. So I did got some information I'll get to Ben later to kind of mull over, because you know, it's definitely getting bigger and bigger in areas, and a lot more value, right? Not to replace workers, but to help people with their jobs and stuff, right? So I did go to BRFA meeting before FCM. I think it was after our last council meeting, but there wasn't really much to report there. Alberta winning games as well, so that one's chugging along. You know, we're now less than 12 months away from the next game, so I did talk to someone at FCM. I guess this might be one of the value things. She was from Strathcona, and she offered a whole bunch of volunteers for the Alberta Winter Games to come down from, because they're hosting the summer games right after that, Alberta Summer Games. So anyways, I'm going to reach out to Violet about that. And then yesterday I went to the doctor recruitment and what's the name of that?
Retention.
Yeah, and retention committee. And that was good. It was a lot of good information shared there. The one thing that come out of it, I guess, was from Dr. Hansen was talking about there's 3 vacancies in Bonnyville right now that they're looking to fill. But we kind of talked to him a bit about, well, Ben was there too, about the program that we have for the scholarship for medical students. So I think we need to really kind of sit down with him and his group to see how we can better even utilize that. If there's things we need to change or update. So that program could be very beneficial if we're doing it properly. So
Thank you.
that's about it.
Yeah. Councillor Kraviak.
Thank you. I had a Bonneville Library Board meeting, nothing much to report there. And the police committee meeting, public safety, they had 408 traffic stops, 510 traffic tickets or warnings being issued. There were 4 joint force operations conducted within the EMD of Bonnyville. Some speeding infractions, people going like 180 clicks an hour, 150 clicks an hour, so.
188 clicks per hour.
188, yeah. That wasn't me.
Yeah. Thanks for getting that straight.
Cold Lake, RCMP, 1,661 files from April 14th to June 9th. The Cold Lake Detachment currently has 2 hard vacancy and 4 soft. 2 members are being identified to be transferred out and are in the relocation process. 1 member will be gone at the end of June, but they are currently training 3 new members at various stages of the recruitment field. Detachment is expected to receive a recruit that graduates on June 30th. Also, Cold Lake is expected to receive an enhanced position for Cold Lake First Nation. The start date has not been yet determined, but an MOU between the RCMP and the nation has been completed. So that's Cold Lake. Bonneville, they have 2 hard vacancies, 604 files created in April. 143 were traffic related. There were 19 collisions, and of those 19, 9 happened within the MDU Bonneville. So, okay, that's about it for me. Thank you.
Yeah, thank you. Councillor Fadale.
Thanks. The first one I kind of want to address is in correspondence 10.6, Cold Lake Chamber of Commerce, your eyes only, or your eyes needed. There's been some crazy graffiti going on in the city of Cold Lake, and the fanciest, biggest one was on one of my properties. So I made the paper, but not in a good way. So, FCSS, we just finished Seniors Week on June 26th. They're going to have a thing called Canoe Connections, and that's going to be at the beach. It's going to be very similar to the Heritage Days festivals they had in the city of Cold Lake, in the city of Edmonton. So I encourage everybody to try to make it out there. It's Thursday, and it's from 4 o'clock to 7. And another thing I attended was the Assumption grad on, I think, the 28th of May, and a couple more grads coming up. So thank you.
Well, I thank you, Council, for all these reports. You guys are amazing. You guys, I'm proud of you guys, of all you guys do. Just, you guys touch base on mostly what I attended as well. I just want to touch base about Mr. McGregor there. Just a quick story about, I believe I might get this story wrong, but I believe the beams were on a big rig coming from somewhere for the Agriplex when it was first to be, and they wouldn't unload them because they couldn't pay for them. There was something happened and there wasn't efficient money to unload these beams. So I think the trucker was gonna leave. So Mr. McGregor, he went to a bunch of farmers in the area, and someone mentioned to him all the names, but I don't wanna get that wrong and leave someone out, but a bunch of farmers from the area all took out a $10,000 loan to buy these beams, to unload them so they could unload them at the Agriplex, because the guy was gonna leave with the beams, I believe. So, yeah, the seniors building, they named it after Mr. McGregor there. He did a lot of things like, you know, the list is so long of the accomplishments he has and the money raising. He even sold part of the ribbon of the official cutting of the, just to try to make a few more dollars. So got to give this guy credit in our area. Our area would not be the same without this man. And then to touch bases on the RCMP report that you did, Sarah Park is no longer going to be our chief around here. She's stepping down. She'll be sadly missed. She's not stepping down till September, I believe. Yes. Correct? Yeah, and what an amazing lady. I was proud to have her as our chief in this area. She'll be sadly missed, but she's staying here. So she loved the area, so she's staying here. So we're very fortunate that have a amazing lady like that staying in our area to continue raising. I think her family's almost raised already, but I guess as a parent, your family's never complete. Anyway, thank you, and on to what's next. We need a oh, go ahead.
Is there a musical ride in
Oh, yes, yeah. Go ahead.
Oh, you go ahead, yeah.
Yeah. I guess there's a musical ride. Do you remember the date?
July 24th.
July 24th, Cold Lake Detachment has got the musical RCMP ride. And is that correct? December, or sorry, July 24th, yeah.
Sorry, I forgot about that.
Yeah, no, I should have remembered about it too. Yeah, no, good job. Thank you. We're just looking for a motion to go on the camera, is that correct?
No camera.
Any camera? Okay, can I call one? All right, I need to go into camera.
Quick recess, and then we'll go for a motion. We're
Okay,
just going to
very
clarify
good.
administration under what FLOIP. We're going to step into camera.
Okay, thank you. All right, welcome back. I need a motion that's going to come up on the screen here in a bit. All right, looking for a motion, gentlemen. Who would like to make this? Councillor Crick makes this motion that council approves the following additions to the agenda. Under 12, closed session, 12.1, land FOIP, section 25. Any discussion on this motion? I seeing none, I'll call for the vote. And if your computer's shut off, raise your hand. Okay, everyone's in favor? Yeah, everyone's in favor. That's carried, thank you. And now we need another motion. All right, who would like to make this motion? All right, thank you, Councillor Fadeev, for making this motion that the meeting goes into closed session at 11 a.m. for the following reasons: FOIP section 25. Any discussion? Seeing none, I'll call for the vote. That's hands are up. Yeah, 3. Everyone's in favor. Carried. Thank you. Welcome back, ladies and gentlemen. I'm just looking for a motion to adjourn now. Thank you, Councillor Kraviak. Any discussion? All in favor? We're just going to do the old hand way. That's carried. Thank you.